Hello professors, my name is Melisa and today I'm going to be demonstrating probing and fulcruming. So we're going to be using a UNC 12 and we're going to detect the periodontal pocket and determine the health status of the periodontium. So we're going to start with a procedure by having me, my patient, my equipment, and my non-dominant hand. So I'm going to be in a neutral body position, which is going to be standing up for this video because it's better for ergonomics and it's easier to show on the video. We're going to have my patient and he's going to be at 9 o'clock. His chin is going to be down and it's going to be slightly away. And then we're going to have my light, which is right here. And we're going to have my non-dominant hand. In my non-dominant hand, I have the mirror, and we use it to retract the cheek or the buccal and the tongue. If we were in clinic, we would be using it. For this purpose of the video, we're not going to be using it so that we can see better. So we're going to be using a modified pen grasp, which would look something like this. Okay, and when we start probing, we're going to start probing always on the distal line angle towards the back. When we probe, we're going to be using walking strokes. We're going to be taking 1 to 2 millimeters. So we're going to start at the distal line angle, fulcruming, making sure everything is right. And it's always going to be 2 or 1 to 2, 3 sometimes teeth away when you fulcrum. So you insert at the distal line angle and go all the way around the tooth. Since there's no tooth next to tooth 32, we don't have to tilt the probe. If we were on the mesial side, we'd go all the way around. And we would bend the probe so we can get into the contact area. And then you take it out. When you first probe, you don't want to take out the probe. You want to keep it inserted the whole time when you probe on one tooth. And we're always going to be taking 3 measurements per side, 6 total, 3 on the buccal and 3 on the lingual. So on tooth 31, I'm going to start at the distal line angle. Tilt the probe and get into the contact area. Go to the mesial side. We're going to be pivoting. And then get into the contact area. Okay, now we're going to moving on to tooth 30. So we're going to insert at the distal line angle. Go into the contact area, tilt the probe. Get into the contact area, and then insert a distal line angle, get into the contact area. Okay, and we're done.